some occupations have more sun exposure. So yesterday I did Mohs on a patient who was a mail carrier. She was out in the sun carrying mail for decades and she gets multiple skin cancers.
Yeah.
Pilots, they're at higher risk also, more UV exposure.
Real skin, real science, real confidence. With Dr. Zain Hussein. Welcome to
Skin Side
Out.
Welcome to Skin Side Out. I'm your host, Dr. Zain, with Heather and Courtney. So May is Skin Cancer Awareness Month. So I think it's really important to go over how a complete full body skin exam should look like. And it's really important because skin checks are our way to monitor our patients, make sure that they are free of skin cancer. And if there is something suspicious, we take care of it so that, we can help our patients, avoid skin cancer or cure them. We're going to break down the anatomy of a skin check. So let's get right into it. What is a skin check?
A skin check, or a full body skin exam, or total body skin exam, some people call it, is where your dermatology provider is looking anywhere and everywhere you're comfortable with them looking to make sure your skin is healthy, make sure your moles look benign. It is important to normalize annual skin checks because a lot of people don't know that we recommend doing annual for most people. And I think there are a lot of people who are nervous about a full body skin exam, whether they're nervous about what the process looks like or just like being in a little paper gown. So we'll kind of walk you through that to hopefully get you more comfortable.
What do you mean? It's not crazy to be nervous about undressing in front of people you don't know and exposing all of your medical history.
Yeah.
So what can you expect when you arrive for your full body skin exam?
Medical history, all of that is pretty pertinent information, especially if you have a family history. You definitely want to disclose that, whether it's a family history melanoma or even like a non-melanoma skin cancer, such as basal, squamous cell. Typically, you'll get called back by the medical assistant who will put you in a gown. Everywhere that I've worked, we've always had the gown open in the back. So normally they'll tell you to get undressed. I usually tell patients to keep their underwear on, and then, but everyone's different. Sometimes people actually come in like without any underwear, and that's fine too. Whatever your comfort level is, we're comfortable too. And
skin is skin.
Skin is skin. We're going to look at it. Exactly.
Yeah. I get a lot of people who will apologize for things like, oh, I'm so sorry I didn't shave my legs. I'm like, girl, I don't care.
Yeah.
And then I have a lot of people will apologize for not having their toes done. And I'm like, I would rather you not have nail polish on.
I thank them for that.
Yeah, because then we can look at your nails, which I think is really important and people don't really think about. And some people, come in with makeup and that's totally fine. It's just harder to look at the skin that way.
Yeah, or they'll come in like, I'm sorry I didn't put any lotion on today. And it's like an older man, and it's like, you haven't put lotion on in 6 years. That is not one day miss. That's a whole process.
About normalizing it. I mean, we see it all. We see men, women, kids, and we do this all day long. So there's nothing that's really going to shock us.
Yeah.
So, just keep that in mind.
And just to kind of explain a little bit, you're not changing in front of people. We obviously step out, let you undress, and then, prepare yourself, and then we'll come back in the room.
Yeah.
Yeah. Like a massage.
Yeah.
So now that we are ready for our skin exam, so what are the actual steps?
Every provider has their own systematic way of doing a full body skin exam. I've seen some people will have the patient lay completely down and start from head to toe, then they flip over and then toes to head. I think we do it very similarly where we kind of start with the back of the scalp, work our way down, and then kind of toes forward too. But every provider has their way of doing it to make sure that they're not missing anything. So, like I said, we'll look everywhere that you're comfortable looking.
And And also, I was going to add, there usually will be a medical assistant in the room,
Yes.
and that is kind of dually functioning. Number one, it's protecting the patient. It's also protecting the provider, but they also are documenting everything that the medical provider is seeing. So it's really important that that medical assistant is in there. I think some people get a little freaked out about, I'm going in and I have, this person who's just typing everything away, and it feels really intimidating, but they are literally just tracking all of your moles and bumps and lumps and whatever, so that that medical note is really complete.
And I think if there is something that you're concerned about or nervous about, like if it's in a private area, the medical assistant can always turn around in the room.
or
We
step
do
out.
see that very commonly, and I think that makes people feel a little bit more comfortable.
Yeah. What are some unusual areas that people are often surprised that we check? So we talked about, like, we do check, the genital areas, but between toes, I find that, patients are always shocked. I'm like, I've never had a skin check before that, where they check before the toes, but I'm like, skin cancer can occur there. And I've had patients who've had skin cancer there.
Yeah. Even
Ears.
in the hair. Yeah, people don't think about.
Yeah. And in the mouth, oral, lesions can occur. And then also in the back of the eye. So when I tell my patients, just for health maintenance, if you're seeing your eye doctor, your dentist, if women are seeing their OBGYNs, it's really important that, they get a thorough examination, because they can sometimes see things that we can't see. So I always put that, in my exam.
Yeah.
What are you guys looking for during a skin exam?
Lots of
Lots of things. And it comes with, a lot of training and just doing a ton of skin checks. I mean, you're analyzing sometimes hundreds of lesions on a patient. You're looking for patterns. You're looking for, unusual features. You're looking for comparisons of lesions to other lesions. And, there's a lot that goes into it. And patients don't necessarily know that we're doing all this in our heads while we're looking. They're just thinking like, oh, you're just looking at me.
Yeah.
And, it didn't seem like you did anything. I'm like, no, we've been doing a lot, actually.
Yeah.
And it took us years to be able to do this in an efficient manner. So what a patient may think of as a cursory look is actually a deep analysis of a lot of things going on in your skin, and not just lesions for, that we're concerned about for skin cancer, but other things that we notice for your skin health, and that can have other implications.
Yeah. Obviously, we're looking for concerning things like skin cancer, but also, we point out lots of genetic spots, and you might have growths that are very common. And so we kind of walk you through that process. But I think the classic way that people think about what we're looking for, especially for melanoma, is what we call the ABCDEs. These are criteria that we're looking for in moles to see, okay, is this a red flag? Should I biopsy this? What should I do? So A stands for asymmetry. So if you were to cut the mole in half, top versus bottom or left versus right, is it the same? If not, could be a red flag. B is for borders. So if it's not a nice circular border, if it's got kind of like wonky borders, that could be a red flag. C is color. So you can have 2 colors in a mole and it is typically fine. Not always, but anything more than 2 could be a red flag, especially if it's like it has this like white hue over it, or potentially like bluish gray changes. Now there are sometimes benign moles that are bluish gray, but definitely more than 2 colors could be a red flag. D is diameter, so anything greater than 6 millimeters, which is about the size of a pencil eraser. And then E is evolution, so something that's new or changing.
And these are very fundamental features. This is something that you can do at home, and a layperson can follow these ABCDEs, but skin cancer and melanoma don't always respect these features. So that's where the nuance comes in. That's when, when we're looking at lesions, we're doing a lot of analysis. We're often using a dermatoscope, which is a tool that helps us to magnify the pigment, the structures. We're looking at a lot of different structures under that polarized light, and it does help us discern, what are benign moles versus something that's more concerning, and whether we need to biopsy it or not. So I do think that although this is a helpful framework, it's not, dogma that you just have to be, just following by the T. And also there's some, moles that have no color. Amelanotic melanoma is extremely, scary. I mean, just because the biggest thing that we hear about melanoma is pigment, right? We don't expect it to be non-pigmented.
Yeah, a lot of lesions don't read the textbook before they show up on your skin.
Yeah. So melanoma is obviously something that we talk about a lot because it has a lot of fatal implications, but there are other skin cancers that we're looking for. So Courtney, what other skin cancers are we typically analyzing for?
So typically we're looking for basal cell, squamous cell skin cancers, precancerous spots called actinic keratoses, which can develop into a skin cancer. Sometimes we're looking not at even the big picture of melanoma, but just atypical moles that might have some, atypical features within the mole. I think sometimes people are always shocked because how basal cells and squamous cells can sometimes present, or, sometimes they'll have a spot. I know we had a patient recently who thought she nicked herself with like a rose thorn, and, she comes back and it's still not healed. And it ended up being, I think, a basal, a squamous or basal. So I think sometimes people are a little shocked when a provider finds something and they're like, oh, this red spot, like that's nothing. It's just a red spot. They kind of associate it with like a rash or just a one-off, but you'd be surprised to know. And then when that spot comes back as, skin cancer.
So I had a patient I did Mohs surgery on yesterday who happens to be a physician who had thought this lesion on his forehead was due to like a car accident he was involved with like 5-6 years ago. And it just, never went away. He thought it was a shard of glass from that. But the minute I looked at him, like, that's not a shard of glass. That's something that needs to be taken care of. So we biopsied it, came back as a basal cell. And even doctors get fooled by it. He was staring at it as like a target on the center of his forehead. But thankfully, we biopsied it and he's cured.
It's funny. Sometimes I feel like the things that patients are most concerned about are the things that we're like, yeah, that's just an age spot. But then it's like the things that they don't even think twice about. That's when you guys are like, nope, we got to biopsy that.
Yeah.
It's always a seborrheic keratosis that they're going to die from.
They're so dark.
And there are other rare tumors out there. So Merkel cell carcinoma, sebaceous carcinoma. There's a lot of different.
The D1, dermatos, or the
DFSP.
DFSP,
Yeah. So there's a lot of them out there. So they could present very similarly, and it really isn't until you do the biopsy and look under the microscope that you really establish the diagnosis. So let's talk about some vocabulary, nomenclature that we use when we're doing our skin exam. Sometimes we're, obviously verbalizing our exam. So what are some words that we typically use?
Sometimes that throws patients off because they don't realize that the provider is talking to the medical assistant so that they can scribe everything. And sometimes the patients are like, what language are you speaking? So that's really, again, just to help whoever is scribing make sure they're documenting all of those spots. But benign is a good term that you want to hear, just meaning that it's not worrisome or not, dangerous, essentially. Nevus, which just means mole.
Or nevi, multiple.
Seborrheic keratoses, which are those genetic age spots. People call them barnacles. I've heard all
Wisdom
different wisdom spots. Yeah, no one likes the term age spot. It's not fun.
Weeds in the garden of life.
I like that.
Oh, I've never heard that one.
Oh, really?
I love hearing the names that patients come up with for like the SKs because, and it's SK, we'll abbreviate it, but what they come up with is always really funny.
Yeah.
Cherry angiomas are one of my favorites because so cute. Like, those look like a little cherry.
Yeah. People call those blood moles.
Oh.
Sounds a lot more treacherous, but those are benign.
I do think,
genetic.
though, like, if somebody has, like, one and it's a decent size, they often think it's a mole and then they're worried about it because it's red.
Yeah.
Yeah.
Yeah. And then what is a biopsy? I mean, I think patients hear that term and then they get nervous. So what does that entail?
A biopsy is where we're taking a portion of the skin to test for it and see what's going on. So typically we'll send it off to an outside pathologist and they'll freeze the tissue and look at it under a microscope to be able to see what's going on at a deeper level.
Yeah. And that's typically what, a shave biopsy, correct?
Usually,
for most of them that
yeah.
are raised. But sometimes we perform, punch biopsies as well. And, in both instances, it gives us more information to establish the diagnosis. And that's what I always explain to our patients. Like, it's always better to be safe rather than sorry, especially if it's something that we're concerned about. And I know that sometimes they're worried about a scar, but then I also remind them, like, it's better to have a scar than potentially having, a skin cancer that can, cause a lot of destruction, sometimes even death.
Yeah.
Yeah, I think people hear the word biopsy and you just kind of think to all these other more invasive procedures, but truly a skin biopsy is over before you know it. I think, you're just locally numbing the area, so there's not any you're not in there for hours. It's a very quick procedure. I mean, maybe sometimes even like 2 minutes flat. So it's not as invasive as like maybe like some other biopsies are, like a thyroid I think people assume
Or
it's like
breast biopsy.
yeah, they're like going deep in there, but it's a very superficial shape of just that top layer.
Yeah.
The beauty of the skin is very easily accessible. So we've done many skin exams. What are the most common, I guess, things that patients are worried about when they're getting their skin exam, especially for the first time?
Yeah, I think we always get the question like, do I have to be fully undressed, or like, how far do I undress? And, like Courtney mentioned, it's common for most people to remove everything except your underwear. Some females do leave bras on, but it's really whatever you're comfortable with.
What about those questions? Oh, I didn't shave.
It's fine.
It's fine.
Yeah.
Me either, girl.
Yeah.
What if I'm on my period?
Fine.
Don't care.
And then what if I'm embarrassed about something on my skin?
Don't be.
I mean, it's a no judgment zone.
Yeah,
Good
no
to be.
judgment. I think, like Dr. Hussein mentioned, we've probably seen it. I think we are in the room with patients during a very vulnerable time. And so it's very common for people to feel that way, but you're in a safe place.
For us, this is every day. So, I think patients don't realize that side of it. In their head, I think as providers also always need to empathize that, this is their first time. Like, they have concerns, they're nervous. And even though this is something so typical for you guys, this is like this could be like someone's like worst day of the week that they've been like fearing for the last week, I really don't want to go get the skin check. What if I have melanoma, yada, yada. So, but again, like also for people to realize that, this is just a daily occurrence for us. So it's not even something we really think twice about.
Yeah. And then I always try to avoid any type of shame. I don't want them to really harp on their own insecurities. I always try to like make it a positive experience for the patient. I never want to dwell on anything that they may be insecure about. So that's something that I think is important.
Yeah.
Yeah. And if your provider brings up stuff, I know sometimes you guys will bring up, like, if someone is dealing with like foot fungus or like, sebderm and rosacea, and it's like, I think sometimes people don't want to ask about those things, but like maybe they are bothersome, or maybe they didn't think about it. Maybe their scalp's been itchy the last couple months.
Or like
and
sweating.
So excessive sweating, that's something that a lot of people, I think, don't realize that they can ask their dermatologist about. And so I think, when we're able to bring up those conversations, it's just to really make the patient's life easier and treat those.
And for them to know that there are treatments out
Exactly.
there.
Yeah. They don't have to suffer.
What about the common question? I have a bunch of other skin issues that I want to talk about. How do we address that?
You have a 15-minute time.
I mean, it's
When
very
you've got
difficult.
your hand on the handle. Oh, wait.
It's very difficult, especially like I think it's really important to try to stay on time. I mean, I know doctors are notorious for running behind. And I really do like distinguishing like a full body skin exam from other dermatologic concerns so that we can offer you the best experience, the best care treatment plan out there. It's hard to devote all that time. If you want a thorough skin exam, I won't have time to really delve into other things unless we do have time when, it could happen. But I wouldn't expect to. I would just make another appointment so we could really talk about those in depth.
Yeah, I think I've seen a couple of patients where they book a skin exam and then it's also a full body rash. And so I think that's really difficult to do. And I don't think you would get a true full body skin exam if you do have a rash that takes up a large surface area because we can't see what's going on with all that inflammation there.
And you don't want like an unnecessary biopsy. I remember you had that patient last year who had a really bad rash across her body and we didn't know she had a large history of skin cancer, but we didn't know what was skin cancer versus what was the rash. And we wanted to clear up the rash because we didn't want to just unnecessarily biopsy her and then it come back as rash. So sometimes they can overlap, what things look like. And I always tell rash
if they're
people,
like picked at or traumatized.
Yeah, I always tell them clear the rash and then, get your skin checked. But
How long does a skin exam typically take?
About 10 to 15 minutes.
Yeah.
It should.
It should.
I think there are some places where it takes 30 seconds. So just make sure you feel comfortable where you're going and you're getting a thorough exam. I think I do get a lot of patients who thank me for taking the time and doing a thorough exam because I think they've had previous.
Yeah, and like I said, I hear from a lot of patients, I've never had my dermatologist look at my scalp or in the buttock area or between the toes. I didn't even know that was a thing. And that's really part of a true comprehensive skin exam. So you should be looking all over.
Yeah.
Yeah. All right. So how should a patient prepare for their skin exam? They're getting ready for their appointment. What should they be doing?
I think no makeup if you can. I try to tell patients to avoid that just because, especially the face, if they're looking at any spots of concern, makeup can hide those. Nail polish, if you have any concerns on the nails, or even I think just in general, trying to avoid that. Toe polish, before you go in. I think bringing up newer changing moles, especially because sometimes a provider is not going to point out every single lesion that you have because we would be there all day. And some people are especially lesion-y. I won't even say moly because some people are just covered in like cherry angiomas or SKs. But I think if you are concerned about specific spots, even during the exam, when they're looking you over, if they scan that and they don't say anything, they're assuming it's benign. The patient at that point, if you are concerned, then I would just say, hey, that's right. That's fine, right? I think if you have any concerning moles, just making sure that you let your provider know is important.
Yeah, I'll oftentimes, if they have multiple areas that they're worried about, I'll just tell them, when I get to that area, just point it out to me and we can talk about it. I think it's good to have either a mental note of that, or if you have photos of lesions and how they've been changing, that's helpful too. I know we've mentioned that in a previous episode, that photos are really helpful to see the chronologic pattern of a spot.
Especially with patients who have a history of many atypical nevi or just funny looking moles. Full body photography and mole mapping can be extremely helpful for discerning those kind of changes as well.
Yeah, I think one thing we haven't mentioned, which is sometimes difficult to do, but really, really helpful, is getting previous records. So if you've been to a different dermatology office and they've done biopsies, the most important thing that we can have is previous pathology. We don't necessarily have to have every single visit know that they saw you for acne and shingles and yada yada and a toenail, whatever. But the biopsies are really helpful.
Yeah, I would say getting your family history too. I mean, my parents are going to kill me, but it's not everyone has parents that disclose their history medically. So I didn't even know that my dad had a skin cancer removed on his back until last year, and this happened years ago. So I don't have any family history, but like I actually do. But it can just be helpful in like giving providers the full picture of things, especially like I said, a family history of melanoma. They might want to be a little bit more cautious, and if there is something that's changing, there might be a little less hesitancy to biopsy it. So
Yeah. So how often should patients be checked?
Mostly annually. I think it depends on the skin type, the age, your history. If you've had melanoma recently, then you should be getting skin exams every 3 months. If you've had a basal or squamous cell, that should be every 6 months for the first 2 years.
Are there patients that really don't need a skin check annually?
For darker skin types, you don't necessarily have to do every year. If you have a lot of moles, then I think it is safe to do, but some people do it like once every 3 years. It kind of depends on the person.
Yeah. Have you all had full body skin exams before?
Yeah.
oh yeah, Heather just did mine like a month ago.
A month ago.
Okay, my time's bad. But I guess it was like 3 months ago. You did it recently.
I feel like it was like almost a year ago.
It was
Either way.
We will
Yes,
check the
we
record.
have. Have you?
That's my little secret.
Oh my gosh.
Yeah, I've never had a skin exam before.
Someone write the headline. That's crazy. And you're over here like preaching to these people.
I know.
Like not even in school or anything. Like that's crazy.
Even when you were growing up?
Well, with a dermatologist, no.
Okay. Okay.
That is on my list. The 40 list.
Okay. It's coming up. That should have been on like your New Year's resolution list.
I think it was.
Years ago.
Yeah, in like 2010.
Yes, we will get to that. So the risk factors that do make us a little bit more worried, the family history, sun exposure. I actually ask about burns, like if you had like a blistering sunburn, because even like a single blistering sunburn increases your risk of melanoma.
Yeah, much greater.
And also, I talk about like occupation, because some occupations have more sun exposure. So yesterday I did Mohs on a patient who was a mail carrier. She was out in the sun carrying mail for decades, and she gets multiple skin cancers.
Yeah.
So that's something. Pilots, they're at higher risk also, more UV exposure. So I think that's always also important to, note. And then also just, sports, things like that, like lifeguarding in the past. Those are all things that oftentimes are associated with a lot of sun exposure.
Farmers.
Yep.
Farmers.
Do you think we're, maybe towards the end of our careers, do you think we're going to see less skin cancers? I feel like a lot of younger people are like really in tune with their sunscreen use
Yeah, but I'm also
nowadays.
seeing a resurgence of tanning.
And people not using sunscreen because they think it's,
Toxic.
yeah.
True. Yeah.
So
So probably not.
who knows? There's more awareness.
Yeah.
But also a lot of people doing things that aren't too smart.
Yeah.
And who knows, like with our ozone, like not to get into climate change, but like with the ozone, more sun.
When I was in South
UV.
Africa, I burned so quickly.
Yeah.
Yeah. But yeah.
I know. I feel like I need to do like a topical chemo on my chest because I just feel like I've had so many blistering sunburns there.
Yeah. Yeah.
All right, so let's end off with a real patient scenario. So patient comes in and they're coming in for a routine skin check and had a spot that they thought was nothing. So walk me through how we would handle this patient for a skin check.
Like if we pointed something out and we were worried about it and they,
Yep. They thought it was like nothing, but we're worried about it.
okay. I like to explain why I'm worried about it without getting like too scientifical. I think a lot of trust with your provider is very important. And so if we have a reason for why we feel like this spot and not the one right next to it, I think it is very important to listen to what they have to say.
I think reassuring them that even if it does come back as a skin cancer, we can treat it. We treat it there in the office for the most part. So I think just reassuring them that like almost like we'll get through it together, because sometimes I think people just get anxious. Like they think worst case scenario.
So now that you know what the anatomy of a skin exam is, I think hopefully it relieves some anxiety for patients who never had one before. It really is, a painless exam unless we're doing like a biopsy, but it's really not that bad. And I think it's always empowering to have that knowledge and the reassurance. And I know that there are always patients who would rather not know than know, because they just rather not know. And, ignorance is bliss. But I don't like that approach. I think that if there's something that we can do that's relatively easy and can avoid future harm, I'm all for it.
Yeah, I don't think that we touched on another very common procedure that we do during skin exams, but freezing with liquid nitrogen, especially for like I don't want to say our older patients, but like people who have lived longer. Sometimes your provider might whip out this shiny, beautiful can, and it's usually blue and silver. And when they spray it, it looks like a gun, and it's just liquid nitrogen, which treats the precancerous spots. It usually will have a little bit of like a so cold it burns feeling, but that is I feel like a common thing we usually will do during skin checks too.
Yeah, and we use it also on benign lesions like seborrheic keratoses, warts, skin tags, a variety of different things, but it is our handy tool.
Yeah, don't be scared of the can.
Some people do get really scared of the can.
They do not like that can.
They're like, why'd you bring that in?
Yeah, they like immediately clock it, and you're like trying to hide it. You're like, no, it's okay. Hopefully we don't need this. Just in case. If I don't bring it, I'm gonna need it.
Yeah.
It does look a little menacing, doesn't it?
Yeah.
I had a provider that used to put a little like needle tip on there just so that for more focal points. But whenever she had to freeze like a wart for kids, they would freak out because they thought that she was gonna like stab them with the can. She was like, "This is not touching you." Like,
I honestly think I've seen like an attending that by accidentally like poke them with it.
Oh, wow.
Yeah. So don't do that. I have an idea. What if we got like
little
like
holsters?
Yeah, that were like little animals, or like something that like would be friendly and
that's a much better idea than your edible sunscreen.
Edible sunscreen.
Yeah, he wants to market edible sunscreen, which I'm pretty sure the FDA is like, no, like you can't do that.
Oh, like a
Food
supplement that you take?
Because he says when he slathers his sunscreen on, he gets it in his mouth. And I said, that sounds like a very niche problem that I don't think anyone else has. But I like the other idea. I think Pete's offices could use it.
Yeah,
Derm
especially
offices.
like for warts, and then even
Like
adults could appreciate
like
it.
a friendly little zebra that's like, an elephant, something fun.
Elmo.
Yeah.
This is history. An axolotl.
An axolotl, Cookie Monster. The possibilities are endless, really.
Yeah, Bluey.
Comment your choice down below.
Yeah. What would you want your
favorite
liquid nitrogen cover to be?
How about a dragon and like the the freezing is kind of like
I think the
strong.
elephant's a good idea with like the trunk could be.
I like that, yeah.
Or Olaf, like freezing coming out of it.
Or
Let it
something
go.
like what?
Let it freeze.
What could be?
Let your SK go. Let it go.
What could be the handle? Like the handle could be like something. I don't know.
We'll
Like
have to.
Trunk of the elephant.
We're gonna get a whiteboard in tomorrow and start planning our cover ideas.
We'll get votes.
It's being patented, so no one take it. It's trademarked.
All right, so now that we've gone through what a skin exam should look like, I do think that this should hopefully relieve some anxiety. And this is an exam where you can speak with your provider. Like if you have questions, you can ask your questions. It's a no judgment zone. We're here to educate you and also make sure that you're safe and healthy. So there's no dumb questions. Ask away. And if you're really concerned about something, even if it's something that, you thought you've had for a while or, just recently have noticed, I mean, it's never a bad idea to just come in and get seen for that. I think having peace of mind is such a valuable thing. And I always, I'm always shocked with like these patients who've been worried about something for years and they were just worried, just to come in because they didn't want to face the reality. But it's just easier to have that sigh of relief. Everything's okay. And if it's not okay, then we can do something about it and be proactive.
Yeah.
Any other final tips for our skin exams?
You can wear lotion on the day of your skin exam. You can wear lotion.
Yeah, it's totally fine.
Yeah, it's encouraged.
Yes.
Yeah. So you don't take your sock off and it just flakes everywhere.
And if you've never had a skin exam like myself, make sure
Yeah, practice what you preach.
you see your board certified dermatologist and their team.
I'm shook. I am genuinely like, the one thing people are going to get from this episode is like, oh, he didn't get a
Yeah. Well, if he didn't, why should I?
Yeah, don't listen.
Yeah, don't listen.
Just go get it.
Yeah, so book your skin check, and we're always happy to see you. If you have any questions about skin exams, drop some questions below. Please like, follow, but until next time, Skin Side
Out.
Thanks for listening. This episode of Skin Side Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.